Ma'am, I'm just starting the recording. Alli red light bandid tachna, you just start, ma'am. Jyoti ma'am.
Hey, Anusha.
Start, ma'am.
Hello, record start madam.
Start.
It's not started. Recording is not started.
It started.
Yeah, now it started, ma'am. Jyoti ma'am, you can start.
Yeah, thank you. Okay. Am I audible?
Yeah.
Okay. Science knows no country because knowledge belongs to humanity and is the torch which illuminates the world. Science is the highest personification of the nation because that nation will remain the first which carries the furthest the work of thought and intelligence. A famous quote by Louis Pasteur. A very good morning to one and all present here. Welcome back for the Day-2 Multidisciplinary 5-day International Faculty Development Program on Perspectives of Human Health and Environment. Our resource person for Day-2 is Sri Manjunath Reddy sir, Senior Clinical Physiologist, Renal Department of Renal Medicine, New Zealand. And topic for today's session is water treatment for hemodialysis and home dialysis. What are its advantages? Faculty Development Program, the necessary fourth leg, the well-known three-legged stool of academic life, teaching, research, and service, has been assumed to cover the main responsibilities of faculty in the academic communities. But is there a missing leg that would add strength and stability to the stool? Yes, I propose there is. It's Faculty Development Program. I would also propose that faculty committed to teaching should be most articulate advocate. Firstly, I would like to welcome our resource person, Dr. Manjunath Reddy sir, Senior Clinical Physiologist, New Zealand. Welcome, sir.
Thank you.
Next, I take the opportunity to welcome Sri N.R. Nandis, Honorary Secretary, SJRCW, who is always a support for us. I also welcome Sri Shiv Prakash, Honorable President, SJRCW. I would like to welcome Sri Nataraj, Honorary Treasurer, SJRCW. I welcome Srimati Saraswati T. Principal, SJR Rajajinagar PU College. Welcome, ma'am. I am very glad to welcome our beloved Principal, Dr. Prema Siddharaju ma'am, SJR College for Women, who is always enthusiastic, energetic, motivating, encouraging. There is a lot more to tell, to name a few. Welcome, ma'am. A very warm welcome to all our energetic participants from all over the country. I also welcome teaching faculties, coordinators, organizing committee for this FDP. I request Srimati Siddhalingamma, Head of the Department Physics, to introduce the speaker. Over to you, madam.
Thank you. Yeah, thank you, Jyoti.
Yes, ma'am.
Am I audible?
Yes, ma'am, you can.
Yeah. A very good morning to one and all. Myself, Siddhalingamma, Assistant Professor and Head of the Department of Physics, SJR College for Women, Bangalore. This task of introducing our guest of honor and speaker of the day is a great privilege and a proud moment. Mr. Manjunath Reddy sir completed BSc and PG Diploma in Dialysis Therapy from Bangalore and did BHSC Bachelor of Health Science and MHSC Master of Health Science from Manukov Institute of Technology, Auckland, New Zealand. Also done certification of renal pharmacology from the same institute. Sir has more than 28 years of work experience. He is a certified member NZAP ASRDP, that is New Zealand and Australia Society of Renal Dialysis Practitioners, and certified Bonnet BONENT USA Board of Nephrology Examiners, Nursing and Technologists, member CPRD, Certified Physiologist Registration Board, New Zealand, 24/7 emergency on call staff member for ADHB and Starship Children's Hospital. His work and positions held: Senior Clinical Renal Physiologist, Auckland Distance Health Board, Team Leader, Satellite Hemodialysis Units since 1995 to date. Work as Chief Dialysis Therapist, Manipal Hospital, Bangalore, India, 1992-95. About his teaching and special training experience, taken classes for student doctors and nurses and renal technologists in Manipal Hospital. Taken classes for PG students in dialysis technologies in MIT, Auckland, New Zealand. Has treated wide variety of dialysis patients with acute and chronic renal failure and drug overdose with charcoal perfusion plasma exchange. Well versed with all dialysis procedures, both adult and pediatric dialysis. He is presently a senior clinical physiologist, renal dialysis, Department of Renal Medicine, Auckland District Health Board, Auckland, New Zealand. Very proud to say that he was the first Indian origin technologist to be appointed in Auckland. Sir, it is indeed a great honor to have you as a resource person in our midst today. Once again, a hearty welcome you, sir. And a very warm welcome to one and all. Have a happy day. Thank you. Jyoti, it is over to you.
Thank you, Sidlingama ma'am, for your introduction. Now I request our principal, Madam Prema Siddaraju, to take over. Prema ma'am, unmute ma'am.
ಓಕೆ, ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಈಗ ಎರಡನೇ ದಿವಸ ಇವತ್ತು ನಮ್ದು ಈ FDP ಕಾರ್ಯಕ್ರಮ ಶ್ರೀ ಜಗದ್ಗುರು ರೇಣುಕಾಚಾರ್ಯ ವಿದ್ಯಾಸಂಸ್ಥೆಯ ಅಂಗಸಂಸ್ಥೆಯಾದಂತಹ ಶ್ರೀ ಜಗದ್ಗುರು ರೇಣುಕಾಚಾರ್ಯ ಮಹಿಳಾ ಕಾಲೇಜು 5 ದಿನಗಳ FDP ಕಾರ್ಯಕ್ರಮವನ್ನ ನಡೆಸ್ತಾ ಇರುವಲ್ಲಿ ನಿನ್ನೆ USA ಬಸವರಾಜು ಸರ್ ನಡೆಸ್ಕೊಟ್ಟಿದ್ದಾರೆ. ತುಂಬಾ ಅತ್ಯುತ್ತಮವಾಗಿ ನಡೆದಂತಹ ಕಾರ್ಯಕ್ರಮ ಆಗಿತ್ತು. ಇವತ್ತು ಶ್ರೀಯುತ ಮಂಜುನಾಥ್ ರೆಡ್ಡಿ ಅವರು ರಿಸೋರ್ಸ್ ಪರ್ಸನ್ ಆಗಿ ಭಾಗವಹಿಸಿದ್ದಾರೆ. ಇವತ್ತಿನ ವೇದಿಕೆಯಲ್ಲಿರುವಂತಹ ಮಾನ್ಯ ಮಂಜುನಾಥ್ ರೆಡ್ಡಿ ಅವರೇ, ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದ ಅಧ್ಯಕ್ಷತೆಯನ್ನ ವಹಿಸಿರುವಂತಹ ಮೇಡಮ್ ಸರಸ್ವತಿ ಅವರೇ, ದೇಶದ ವಿವಿಧ ಮೂಲೆಗಳಿಂದ ಅಥವಾ ಹೊರದೇಶದ ಕೆಲವೊಂದು ಅಧ್ಯಾಪಕ ಮಿತ್ರರು ಕೂಡ ಇದ್ದಾರೆ. ಇಲ್ಲಿ ಭಾಗವಹಿಸಿರುವಂತಹ ಹಲವಾರು ಅಧ್ಯಾಪಕ ಮಿತ್ರರೇ, ನನ್ನ ಸಹೋದ್ಯೋಗಿ ಮಿತ್ರರೇ ಮತ್ತು ಸಂಶೋಧನಾ ವಿದ್ಯಾರ್ಥಿನಿಯರೇ, ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮ ನಿಜಕ್ಕೂ ಹೆಚ್ಚಿನ ಉಪಯೋಗವನ್ನ ತಂದುಕೊಡುತ್ತೆ ಅಂತ ನಾನು ಅಂದ್ಕೊಳ್ತೀನಿ. ಯಾಕೆ ಅಂದ್ರೆ ಇವತ್ತು ತೀವ್ರವಾದ ಒಂದು ಏನು ತೊಂದರೆಯನ್ನ ಅನುಭವಿಸ್ತಾ ಇರುವಂತ ಸಂದರ್ಭದಲ್ಲಿ, ಡಯಾಲಿಸಿಸ್ ಅನ್ನೋ ಅಂತದ್ದು, ಕಿಡ್ನಿಯನ್ನ ಕಳ್ಕೊಂಡಂತ ಸಂದರ್ಭದಲ್ಲಿ ಹೇಗೆಲ್ಲ ಆರೋಗ್ಯದ ಒಂದು ಕಾಳಜಿಯನ್ನ ಮಾಡ್ಕೊಳ್ಬೇಕಾಗತ್ತೆ, ಆ ಒಂದು ನಿಟ್ಟಿನಲ್ಲಿ ಹೇಗೆ ಒಂದು ಹೊಸ ರೀತಿಯ ಸಂಶೋಧನೆಯನ್ನ, ವಿಶೇಷವಾಗಿ ನಾನು ಹೇಳಲೇಬೇಕು, ಈ ಲಾಕ್ಡೌನ್ ಅಂತ ಸಂದರ್ಭದಲ್ಲಿ, ಕೊರೋನಾ ಆಗಿರುವಂತ ಸಂದರ್ಭದಲ್ಲಿ ಮನೆಯಲ್ಲೇ ಹೇಗೆ ಈ ಒಂದು ಥೆರಪಿಯನ್ನ ಮಾಡ್ಕೊಳ್ಬಹುದು ಅನ್ನುವಂತ ಒಂದು ಹೊಸ ಸಂಶೋಧನೆಗೆ ತಮ್ಮನ್ನ ತೊಡಗಿಸ್ಕೊಂಡಿರುವಂತವ್ರು ಮಂಜುನಾಥ್ ರೆಡ್ಡಿ ಅವರು. ವಿಜ್ಞಾನ ಯಾವಾಗ್ಲೂ ಯಾವ ಸಮಸ್ಯೆ ಬರುತ್ತೆ ಅಂತ ಹೇಳಕ್ಕಾಗಲ್ಲ, ಆ ಸಮಸ್ಯೆಗೆ ಒಂದು ಕೈ ಜೋಡಿಸುವಂತಹ ಕೆಲಸವನ್ನ ಮಾಡುವಂತಹ ಒಂದು ಕಾರ್ಯದಲ್ಲಿ ತಮ್ಮನ್ನ ಸಂಶೋಧನೆಗೆ ತೊಡಗಿಸ್ಕೊಂಡು ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಕೆಲಸವನ್ನ ಮಾಡ್ತಾ ಇರುವಂತವ್ರು ಆ ವಿಚಾರವನ್ನ ಇವತ್ತು ನಮ್ಮ ಈ ಒಂದು ವೇದಿಕೆಯಲ್ಲಿ ತಿಳಿಸ್ಕೊಡೋರಿದ್ದಾರೆ. ಈಗಾಗ್ಲೇ ಅವರ ಅಕಾಡೆಮಿಕ್ ವರ್ಕ್ ಗಳಿಗೆ ಸಂಬಂಧಪಟ್ಟ ಹಾಗೆ ಸಿದ್ಲಿಂಗಮ್ಮ ಮೇಡಮ್ ಚೆನ್ನಾಗಿ ಪರಿಚಯ ಮಾಡ್ಕೊಟ್ಟಿದ್ದಾರೆ. ನಾನು ಅದರಿಂದ ಹೊರತಾದಂತಹ ಮಂಜುನಾಥ್ ರೆಡ್ಡಿ ಅವರು ಹೇಗೆಲ್ಲ ತಮ್ಮನ್ನ ನ್ಯೂಜಿಲೆಂಡ್ ಅಲ್ಲಿ ತೊಡಗಿಸ್ಕೊಂಡಿದ್ದಾರೆ ಅನ್ನೋದನ್ನ ಹೇಳಲೇಬೇಕಾಗಿತ್ತು. ಅದಕ್ಕೆ ನಾನು ಇವತ್ತು 2 ನಿಮಿಷದ ಅವಕಾಶವನ್ನ ತೆಗೆದುಕೊಂಡಿದ್ದೇನೆ. ಮೊದಲನೇದಾಗಿ ನಾನ್ ನಿನ್ನೆನೆ ಹೇಳ್ಕೊಂಡ ಹಾಗೆ ಶ್ರೀ ಜಗದ್ಗುರು ರೇಣುಕಾಚಾರ್ಯ ವಿದ್ಯಾಸಂಸ್ಥೆಯ ವಿದ್ಯಾರ್ಥಿ ನಮ್ಮ ಮಂಜುನಾಥ್ ರೆಡ್ಡಿ ಅನ್ನುವಂಥದ್ದು ನನಗೆ ಹೆಮ್ಮೆಯಿಂದ ಹೇಳ್ಕೊಳ್ಳೋ ಅಂತದ್ದು. ಅವರು ನಮ್ಮಲ್ಲಿ BSc ಯನ್ನ ಓದಂತವ್ರು, ನಮ್ಗಿಂತ ಹಿರಿಯ ವಿದ್ಯಾರ್ಥಿ ಆಗಿದ್ದಂತವ್ರು. ನಾವೆಲ್ಲ ಅಲ್ಲೇ ಓದ್ದವ್ರು. ಸೊ ನಾವೆಲ್ಲ ಅಲ್ಲಿ ಅಲ್ಯುಮಿನಿ ಅಸೋಸಿಯೇಷನ್ ಅಲ್ಲಿ ಒಂದಾಗಿರ್ತೇವೆ. ಸೊ ಅಲ್ಲಿ BSc ಓದಂತವ್ರು. ಪ್ರಪಂಚದ ಮೂಲೆ ಮೂಲೆಯಲ್ಲಿ ಶ್ರೀ ಜಗದ್ಗುರು ರೇಣುಕಾಚಾರ್ಯ ವಿದ್ಯಾಸಂಸ್ಥೆನಲ್ಲಿ ಓದಂತ ವಿದ್ಯಾರ್ಥಿಗಳು, BSc ಪದವಿಯನ್ನ ಪಡ್ಕೊಂಡಂತ ವಿದ್ಯಾರ್ಥಿಗಳು ಪ್ರಪಂಚದ ವಿಜ್ಞಾನ ಕ್ಷೇತ್ರಕ್ಕೆ ಹಲವಾರು ರೀತಿಯ ಸೇವೆಯನ್ನ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಗುರುತರವಾದಂತಹ ಕೆಲವೊಂದು ಸಂಶೋಧನೆಗಳನ್ನ ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಅನ್ನುವಂಥದ್ದನ್ನ ಹೇಳ್ಕೊಳ್ಬೇಕಾಗಿದೆ ನಾವಿವತ್ತು. ಈ ವೆಬಿನಾರ್ ಮುಖಾಂತರ ನಮ್ಮ ಸಂಸ್ಥೆ ಜಗತ್ತಿಗೆ ಕೊಟ್ಟಿರುವಂತಹ ಕೊಡುಗೆ ಅಂತ ನಾ ಹೇಳ್ಕೊಂಡ್ರು ತಪ್ಪಾಗ್ಲಿಕ್ಕಿಲ್ಲ. ಮಂಜುನಾಥ್ ಸರ್ ಅಂತ ಒಬ್ಬ ಶ್ರೇಷ್ಠ ಸಂಶೋಧಕ ಇವತ್ತು ನಮ್ಮ ಒಂದು ಭೂಮಿಗೆ ಕೊಡುಗೆಯಾಗಿದ್ದಾರೆ. ಇವರು ಆ ಕ್ಷೇತ್ರದಲ್ಲಿ ಮಾತ್ರ ಅಲ್ಲ, ನ್ಯೂಜಿಲ್ಯಾಂಡ್ ಅಲ್ಲಿ ಹೋಗಿ ಅಲ್ಲಿ ನೆಲೆಯೂರಿರುವಂತಹ ಇವರು ಕನ್ನಡ ಸಂಘಟನೆಯನ್ನ ಮಾಡಿಕೊಂಡು ಕನ್ನಡ ಸಂಘದಲ್ಲಿ ಸದಸ್ಯರಾಗಿ ಹಲವಾರು ಕಾರ್ಯಕ್ರಮಗಳನ್ನ ಮಾಡ್ತಾ ಹೋಗ್ತಾರೆ. ರಾಜ್ಯೋತ್ಸವ ಕಾರ್ಯಕ್ರಮವನ್ನ ಪ್ರತಿ ವರ್ಷ ನವೆಂಬರ್ ತಿಂಗಳಲ್ಲಿ ಮಾಡ್ತಾರೆ. ಕರ್ನಾಟಕದಿಂದ ಅಲ್ಲಿಗೆ ಒಳ್ಳೊಳ್ಳೆ ಗಣ್ಯ ವ್ಯಕ್ತಿಗಳನ್ನ ಕರೆಸ್ಕೊಂಡು ಆಚರಣೆ ಮಾಡ್ತಾರೆ. ಅಷ್ಟು ಮಾತ್ರ ಅಲ್ಲ, ಇಲ್ಲಿಯ ಯುಗಾದಿ ಹಬ್ಬವನ್ನಾಗ್ಲಿ, ದೀಪಾವಳಿ ಹಬ್ಬವನ್ನಾಗ್ಲಿ, ಸಂಕ್ರಾಂತಿ ಹಬ್ಬವನ್ನಾಗ್ಲಿ ಆಕ್ಲ್ಯಾಂಡ್ ನಲ್ಲಿ ಅದ್ಭುತವಾಗಿ ಆಚರಿಸ್ತಾರೆ. ಅಷ್ಟು ಮಾತ್ರ ಅಲ್ಲ, ಇವರ 2 ಮಕ್ಕಳುಗಳನ್ನ ವೀಕೆಂಡ್ ಅಲ್ಲಿ ನ್ಯೂಜಿಲ್ಯಾಂಡ್ ಅಲ್ಲಿ ಇರುವಂತಹ ಹರೇ ಕೃಷ್ಣ ಶಾಲೆಗೆ ಕಳಿಸ್ತಾರೆ. ಅಲ್ಲಿ ಮಕ್ಕಳು ವೇದವನ್ನ, ಶ್ಲೋಕಗಳನ್ನ ಅಧ್ಯಯನ ಮಾಡ್ತಾರೆ. ನಾನು ಅವರ ಮಕ್ಕಳ ಕೆಲವು ಫೋಟೋಗಳನ್ನ ನೋಡಿದ್ದೇನೆ. ಫ್ಯಾನ್ಸಿ ಡ್ರೆಸ್ ಕಾಂಪಿಟೇಷನ್ ಆಗ್ಬೋದು, ಭರತನಾಟ್ಯ. ಇಲ್ಲಿಯ ಭರತನಾಟ್ಯಗಳನ್ನ, ಜಾನಪದ ಕಲೆಗಳನ್ನ ಕಲಿಯೋದಕ್ಕೆ ಹಿಂದೇಟಾಗ್ತೀವಿ. ಹೊರದೇಶದ ನೃತ್ಯಗಳನ್ನ, ಹೊರದೇಶದ ಮ್ಯೂಸಿಕ್ ಅನ್ನ ನಮ್ಮ ಮಕ್ಕಳಿಗೆ ನಾವಿಲ್ಲಿ ಕಲ್ಸ್ಕೊಡಕ್ ಹೋಗ್ತಿದೀವಿ. ಆದ್ರೆ ನಮ್ಮ ಇಲ್ಲಿಯ ಈ ವಿಜ್ಞಾನಿಗಳು ಹೊರದೇಶದಲ್ಲಿ ಹೋಗಿ ನಮ್ಮ ದೇಶದ ಸಂಸ್ಕೃತಿಯನ್ನ, ನಮ್ಮ ದೇಶದ ಕಂಪನ್ನ ಹೊರಗೆ ಸೂಸ್ತಾ ಇದ್ದಾರೆ ಬೇರೆ ದೇಶಗಳಲ್ಲಿ ಅನ್ನುವಂಥದ್ದು ನಿಜಕ್ಕೂ ನಾವೆಲ್ಲ ಹೆಮ್ಮೆ ಪಟ್ಕೊಳ್ಬಹುದಾದಂತ ವಿಚಾರ. ಅಷ್ಟು ಮಾತ್ರ ಅಲ್ಲ, ಅಲ್ಲಿ ಕನ್ನಡ ಶಾಲೆಯನ್ನ ನಡೆಸ್ತಾ ಇದ್ದಾರೆ. ಇವರೆಲ್ಲ ಸೇರ್ಕೊಂಡು ನ್ಯೂಜಿಲ್ಯಾಂಡ್ ಅಲ್ಲಿ ಕನ್ನಡ ಶಾಲೆಯನ್ನ ನಡೆಸ್ತಾ ಇದ್ದಾರೆ. ಅಲ್ಲಿ ಇವತ್ತಿಗೂ ಕೂಡ 35 ಸ್ಟೂಡೆಂಟ್ಸ್ ಕನ್ನಡ ಶಾಲೆಯಲ್ಲಿ ಕಲಿತಾ ಇದ್ದಾರೆ. ಅಂದ್ರೆ ಕನ್ನಡದ ಬಗ್ಗೆ, ಭಾರತೀಯ ವೇದ ಆಗಮ ಉಪನಿಷತ್ತುಗಳ ಬಗ್ಗೆ ಇವ್ರುಗಳು ಹೋಗಿ ಅಲ್ಲಿ ಅವುಗಳನ್ನ ಅಳವಡಿಸ್ಕೊಳ್ಳೋದ್ರ ಬಗ್ಗೆ, ನಮ್ಮ ಸಂಸ್ಕೃತಿ ಮರೆಮಾಚಿ ಹೋಗ್ಬಾರ್ದು ಅಂತ ಮಕ್ಕಳುಗಳಿಗೆ, ಅಲ್ಲಿಯ ಭಾರತೀಯ ಮಕ್ಕಳುಗಳಿಗೆ ಕಲಿಸ್ತಾ ಇರುವಂತದ್ದು ನಾವೆಲ್ಲ ಖುಷಿಯಿಂದ ಹೇಳ್ಕೊಳ್ಳುವಂತ ವಿಚಾರ. ಒಂದಾದ್ರೆ ಮತ್ತೊಂದು ಇವರು ಮಾಡ್ತಾ ಇರುವಂತ ಸೇವೆ, ಮತ್ತೆ ಇವರು ಬಸವ ಸಮಿತಿಯಲ್ಲೂ ಕೂಡ ಸದಸ್ಯರಾಗಿ, ಆಸ್ಟ್ರೇಲಿಯಾದ ಬಸವ ಸಮಿತಿಯ ಸದಸ್ಯರು ಕೂಡ ಇವರು ಆಗಿರುವಂತದ್ದು. ಅದರ ಮುಖಾಂತರ ವಚನ ಸಾಹಿತ್ಯವನ್ನು ಕೂಡ ಪ್ರಚಾರ ಮಾಡ್ತಾ ಬರುವಂತದ್ದಾಗಿದೆ. ಅಷ್ಟು ಮಾತ್ರ ಅಲ್ಲದೇನೆ ಇವರು ಇಂಡಿಯಾದಿಂದ, ಕರ್ನಾಟಕದಿಂದ ಯಾರೇ ಹೊಸದಾಗಿ ನ್ಯೂಜಿಲೆಂಡ್ಗೆ ಹೋದ್ರೆ ವಿದ್ಯಾರ್ಥಿಗಳಾಗಿರ್ಬಹುದು, ಹೊಸದಾಗಿ ಉದ್ಯೋಗವನ್ನ ಹರಿಸ್ಕೊಂಡು ಹೋಗುವಂತವ್ರಾಗಿರ್ಬಹುದು, ಪ್ರವಾಸಿಗರಾಗಿರ್ಬಹುದು, ಅವರೆಲ್ಲರಿಗೂ ಕೂಡ ಇವರು ಅಲ್ಲಿ ಸಹಾಯ ಹಸ್ತವನ್ನ ಚಾಚ್ತಾರೆ. ಆಕ್ಲ್ಯಾಂಡ್ ನಲ್ಲಿ ಸುಮಾರು 120 ಕನ್ನಡಿಗರ ಕುಟುಂಬಗಳು ಇದೆ ಇವರ ಒಟ್ಟಿಗೆ. ಇವರೆಲ್ಲ ಸೇರಿ ಸಂಘಟನೆಯನ್ನ ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. ಯಾರೇ ಹೊಸದಾಗ ಅಲ್ಲಿ ಹೋದ್ರು ಕೂಡ ಅವ್ರಿಗೆ ಇವ್ರದೇ ಆದಂತ ರೀತಿನಲ್ಲಿ ಯಾವ ರೀತಿ ಅವ್ರಿಗೆ ಸಹಾಯ ಬೇಕೋ, ಹೊಸದಾಗ ಅಲ್ಲಿ ಹೋದವ್ರಿಗೆ ನೆಲೆಯೂರೋದಕ್ಕಾಗ್ಲಿ, ಅಲ್ಲಿ ಏನು ಗೊತ್ತಾಗದೆ ಇದ್ದಾಗ ಅವ್ರಿಗೆ ಬೇಕಾದಂತಹ ಮಾಹಿತಿಗಳನ್ನ ಕೊಡೋದಾಗ್ಲಿ, ಎಲ್ಲಾ ರೀತಿಯ ಆರ್ಥಿಕ ನೆರವನ್ನು ಕೂಡ ಇವರು ನೀಡ್ತಾ ಬಂದಿದ್ದಾರೆ. ಇಂಥ ದೊಡ್ಡ ಮನಸ್ಸಿನ, ವಿಶೇಷವಾದಂತಹ ಚಿಂತನೆಗಳನ್ನ ಉಳ್ಳಂತಹ ಒಬ್ಬ ವಿಜ್ಞಾನಿ, ಒಬ್ಬ ತತ್ವಜ್ಞಾನಿ, ನಮ್ಮ ನಾಡಿನ ಹೆಮ್ಮೆ, ಹೊರದೇಶದಲ್ಲಿ ಬೆಳಗ್ತಾ ಇರುವಂತದ್ದು ನಮ್ಮೆಲ್ಲರಿಗೂ ಹೆಮ್ಮೆ ವಿಚಾರ. ಅಷ್ಟು ಮಾತ್ರ ಅಲ್ಲ, ಭಾರತೀಯರಿಗೆ ಇವರೆಲ್ಲ ಒಂದು ಮಾದರಿಯಾಗಿ ನಿಲ್ಲುವಂತಹ ವ್ಯಕ್ತಿಗಳು. ಇಂಥ ಮಂಜುನಾಥ್ ರೆಡ್ಡಿಯವರು ಇವತ್ತು ನಮ್ಮ ಈ ಒಂದು ಕರೆಗೆ ಹೋಗೊಟ್ಟು, ಅವರ ಸಮಯವಲ್ಲದ ಸಮಯ ಆದ್ರೂ ನಾವು 11 ಗಂಟೆ ಸರ್ ಅಂತ ಕೇಳ್ಕೊಂಡಾಗ ಖಂಡಿತ ನಿಮ್ ಟೈಮ್ಗೆ ನಾನ್ ಮಾಡ್ಕೊಡ್ತೀನಿ ಮೇಡಮ್ ಅಂತ ಹೇಳಿ ಒಪ್ಕೊಂಡು ನಮ್ಮ ಸಮಯಕ್ಕೆ ಒಂದು 2 ವಿಚಾರಗಳನ್ನ ಅತ್ಯಂತ ಪ್ರಸ್ತುತವಾದಂತಹ ಅವರೇ ಕಂಡಿಡಿದಿರುವಂತಹ 2 ವಿಚಾರಗಳನ್ನ ನಮ್ಗೆ ಇವತ್ತು ಪ್ರಸ್ತುತಪಡಿಸಲಿದ್ದಾರೆ. ಸರ್, ನಮ್ಮ ಕರೆಗೆ ಹೋಗೊಟ್ಟು ನೀವು ಇವತ್ತು ನಮ್ಮ ವೆಬಿನಾರ್ ನಲ್ಲಿ ಮಾತನಾಡ್ತಾ ಇರುವಂತದ್ದು ನಮ್ಗೆ ತುಂಬಾ ಹರ್ಷವನ್ನ ಉಂಟು ಮಾಡಿದೆ. ಶ್ರೀ ಜಗದ್ಗುರು ರೇಣುಕಾಚಾರ್ಯ ವಿದ್ಯಾಸಂಸ್ಥೆಯ ಪರವಾಗಿ ಮತ್ತು ಮಹಿಳಾ ಕಾಲೇಜಿನ ಪರವಾಗಿ ನಿಮ್ಗೆ ನಾನು ಅತ್ಯಂತ ತುಂಬು ಹೃದಯದ ಧನ್ಯವಾದಗಳನ್ನ ಅರ್ಪಿಸ್ತೇನೆ. ಹಾಗೆ ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಅಧ್ಯಕ್ಷತೆಯನ್ನ ವಹಿಸೋದಕ್ಕೆ ನಮ್ಮ ವಿದ್ಯಾಸಂಸ್ಥೆಯ ಅಂಗಸಂಸ್ಥೆಯಾದಂತಹ ಶ್ರೀ ಜಗದ್ಗುರು ರೇಣುಕಾಚಾರ್ಯ ರಾಜಾಜಿನಗರ ಪದವಿ ಪೂರ್ವ ಕಾಲೇಜಿನ ಪ್ರಾಂಶುಪಾಲರಾದಂತಹ ಪ್ರೊಫೆಸರ್ ಸರಸ್ವತಿ ಮೇಡಮ್ ಅವರನ್ನ ನಾನು ಕೇಳ್ಕೊಂಡೆ. ಅವರು ಕೂಡ ತುಂಬಾ ಸಂತೋಷದಿಂದ, ಬಹುಶಃ ಮಂಜುನಾಥ್ ಸರ್ ನೋಡಿರ್ಬಹುದೋ ಏನೋ, ಮೇಡಮ್ ಕೂಡ ಅಲ್ಲಿ ಟೀಚ್ ಮಾಡ್ತಾ ಇದ್ರು. ಮಂಜುನಾಥ್ ಸರ್ ಅವ್ರಿಗೆ ಸ್ಟೂಡೆಂಟ್ ಆಗಿದ್ರೋ ಅಥವಾ ಆ ಟೈಮ್ ನಲ್ಲಿ ನೋಡಿದ್ರೋ ನನಗೆ ಗೊತ್ತಿಲ್ಲ. ನನಗೇನಂದ್ರೆ ನಮ್ಮ SJR ವಿದ್ಯಾಸಂಸ್ಥೆಯ ಎಲ್ಲರನ್ನ ಒಂದು ಒಟ್ಟುಗೂಡಿಸಿ ಒಂದು ಪ್ರಯೋಗವನ್ನ ಮಾಡ್ಬೇಕು, ಎಲ್ಲರಿಗೂ ಈ ನಮ್ಮಲ್ಲಿರುವಂತಹ ಪ್ರತಿಭೆಗಳ ಒಂದು ಪರಿಚಯ ಆಗ್ಬೇಕನ್ನೋ ಒಂದು ಆಸೆ, ಜೊತೆಗೆ ನಮ್ಮ ವಿದ್ಯಾರ್ಥಿನಿಯರಿಗೆ ನಮ್ಮ ಸಂಸ್ಥೆ ಬಗ್ಗೆ ಅಥವಾ BSc ಪದವಿಗೆ ಸಂಬಂಧಪಟ್ಟ ಹಾಗೆ ಹೆಚ್ಚಿನ ಒಂದು ಕಾಳಜಿ ಬೇಕು ಅನ್ನುವಂತ ಉದ್ದೇಶ ಇತ್ತು. ಈ ಎಲ್ಲವನ್ನ ಇಟ್ಕೊಂಡು ಸರಸ್ವತಿ ಮೇಡಮ್ ಅವ್ರನ್ನ ಕೇಳ್ಕೊಂಡಾಗ ಮೇಡಮ್ ಕೂಡ ತುಂಬಾ ಸಂತೋಷದಿಂದ ಒಪ್ಪಿ ಇವತ್ತು ಅಧ್ಯಕ್ಷತೆ ವಹಿಸಿದ್ದಾರೆ. ಅವರಿಗೆ ಹಾಗೆ ಪ್ರಪಂಚದ ಮೂಲೆ ಮೂಲೆಗಳಿಂದ ಈ ಒಂದು ವೆಬಿನಾರ್ ನ ಪ್ರಯೋಜನ ಪಡ್ಕೊಳ್ಳೋಕೆ ಈ ಒಂದು ವೇದಿಕೆಯಲ್ಲಿ ಭಾಗವಹಿಸಿರುವಂತಹ ಎಲ್ಲ ಅಧ್ಯಾಪಕ ಮಿತ್ರರಿಗೆ ಮತ್ತು ಈ ಒಂದು ವೆಬಿನಾರ್ ಅನ್ನ ಅಚ್ಚುಕಟ್ಟಾಗಿ ಆಯೋಜಿಸುವಲ್ಲಿ ಸಾಕಷ್ಟು ಸಹಕಾರವನ್ನ ನೀಡ್ತಾ ಇರುವಂತಹ ಸೈಂಟಿಯ ನಮ್ಮ ವಿಜ್ಞಾನ ವೇದಿಕೆಗೆ, ಸೈನ್ಸ್ ಫೋರಂನವರಿಗೆ, ಎಲ್ಲ ಅಧ್ಯಾಪಕ ಮಿತ್ರರಿಗೆ ಮತ್ತು ಇಲ್ಲಿ ಭಾಗವಹಿಸ್ತಾ ಇರುವಂತಹ ಎಲ್ಲ ವಿದ್ಯಾರ್ಥಿನಿಯರಿಗೆ ನನ್ನ ಅಭಿನಂದನೆಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ನನ್ನ ಕೆಲವು ಪ್ರಾಸ್ತಾವಿಕ ಮಾತುಗಳನ್ನ ಮುಗಿಸ್ತೇನೆ. ನಮಸ್ತೆ.
Thank you, Prema ma'am, for your wonderful address. Now I request our guest speaker, Dr. Manjunath Reddy, sir, to take over. So please, you can present your screen, sir.
Thank you, madam. ತುಂಬಾ ಧನ್ಯವಾದಗಳು. ಇಷ್ಟು ಚೆನ್ನಾಗಿ ಸೊಗಸಾಗಿ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ದೀರಾ. ತುಂಬಾ ಥ್ಯಾಂಕ್ಸ್. ಮತ್ತೆ ಎಲ್ಲ ಟೀಚರ್ಸ್ಗೂ ನನ್ನ ನಮಸ್ಕಾರಗಳು. ಕೇಳಿಸ್ತಾ ಇದೆಯಾ ಎಲ್ಲರಿಗೂ?
Yes, sir. Yes, ಕೇಳಿಸ್ತಾ ಇದೆ.
Okay, ಈಗ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ.
Yes, sir. Yes, you can present your screen, sir. First presentation.
Can you see?
Yes, sir. We can see. I think it has to be maximized, no, Anusha?
Slide, yes ma'am.
Slide show ಕೊಡಿ ಸರ್.
Slide show.
Okay. Right?
ಹಾ ಸರ್.
Right.
Yes, sir. It's visible.
Right? Everything okay? Okay.
Yes, sir. It's visible. Carry.
Okay. Good morning, everybody. My name is Manjunath Reddy. I am the clinical renal physiologist from Auckland District Health Board, New Zealand. Today, we are talking about the kidneys. First, we'll talk about the kidneys, and then I'll come to the home dialysis and the water filtration. Okay, so what do the kidneys do? So you all know that kidneys remove waste and extra fluids from your body and maintain a balance of water, salts, and minerals such as sodium, phosphorus, potassium, calcium in your blood. And it also controls your blood pressure, and it also produces red blood cells. And so what is chronic kidney disease means? It's also called as CKD. Chronic kidney refers to a decreased functions of your kidneys based on the blood results or urine tests for about 3 months. That means in the time of 3 months, your doctor or the nephrologist will say that they're going to test for the 3 months, and during that, if there is any decreasing of your functions of the kidney, then they will say that there's some problem in the kidney thing. So they need to investigate that. And during this time, if your kidneys feel okay, then it's called as acute kidney injury. So how to assess the kidney functions? So it's a direct measurement of glomerular filtration, right? It's also called as GFR, and it's all how it is done is called the isotope test. Isotopes test means it's a chemical test, and it's being done through a scan. So a scan means it's a renal scan. It measures the kidney functions by monitoring the flow of the radioisotopes. So that means that's how efficiency your kidney is functioning, and it absorbs and passing it, and it also shows the abnormalities in the structure. That means size, shape, and of your kidneys. So there is also the measurement of glomerular filtration markers, of surrogate markers of GFR in the blood. That means GFR, glomerular filtration, is measured. There's a thing called creatinine. It's a muscle protein, can be used to estimate the GFR. And also the another waste product is called the blood urea nitrogen. And these things can be also, the doctor will also tell you to do the 24 hours urine sample for the creatinine clearance, and also the urine protein albumin, and also the urine blood cells. Let's whether they're passing any red blood cells or not. This GFR, how they calculate is depending on the age, race, sex. There's a formula. So your doctor or the kidney specialist, called as a nephrologist, will always do this test whenever you have this kind of problems. And also they do the blood urea nitrogen, like this called as a BUN. During this 24 hours urine, they monitor the urine creatinine clearance, and it says that how much clearance, how much creatinine is there, and they should be lesser than 60 for the 3 monthly period, like when they're doing the test. So how is chronic kidney disease classified? That means you can see here there are five steps, like stage 1 to stage 2 up to stage 5. That means in the first, when you come, when the doctors decide like there's some kind of symptoms, and there is an increased risk, and they'll say when the first stage is the mild symptoms, like number 1, mild and to extreme, like severe symptoms is level 5, like stage 5. Like stage 1 is only mild symptoms, right? When the kidney damage is normal and the increased GFR is little bit more than 90 or equal to 90, and then they diagnose the treatment of the comorbid condition showing the progression of the cardiovascular disease and risk reduction. And when it's in the stage 2, there's a kidney damage. The kidney damage is nearly about 60 to 70 percentages of that, and that's how where the elimination progressions take place. And the third place is from 30 to 59, like that. So if when you see the last stage is the lesser than 15, like that means they should have a kind of kidney replacement or anything to be done for the dialysis or the kidney transplantation or something like that. That's the severe stage. So, who is at risk for the CKDs? That's kidney disease. So, who is at risk? The people who is having heart problems and high blood pressure problems will have this risk of kidney disease problems. And that means heart problems means they recently had the heart stroke or kind of heart problems. They always tend to have this CKD problems, like chronic kidney problem. Hypertension, like the people with high blood pressures, they should, even they should monitor their bloods every 6 monthly. Like when the people having high blood pressures, they should monitor the blood every 6 monthly or yearly. The doctor will say to do the blood test. And the third, the blood pressure, like hypertension and the diabetes, is the main cause for the kidney failure. Like if you see many people in our Indian subcontinent and many parts of the world, like hypertension and the blood pressure is the main cause for the kidney failure. Like if you see if you are diabetic, they should always check the urine protein and the blood test every 6 months to 1 year, 2 times in a year. They should check for that. And the other thing is obesity. Obesity is also one of the concern, like problem for a risk for the kidney disease problem, because they're too heavy. Their BMI, like BMI should be more than, if they're more than 30, they might have a problem with the kidney failure. And also this family history of kidney disease, hereditary, like usually it's been proved that there's in so many cases there's if there is anybody like grandparents having a kidney problem with so many other things, they have this this kidney, like a polycystic kidneys and other forms of kidneys. There's a hereditary saying that they can be having the kidney disease. And smoking. So for smoking, if a chronic smokers will also tend to risk of kidney disease. The other thing is the chronic use of certain medication, especially the anti-inflammatory, ibuprofen, the painkillers, and somebody else asked the other day the question, like when they go to the gym, they take the steroids and all sort of things. Even that medication to make when they are in when they want to make a 6-pack, when they're having 1 pack, they want to make a 6-packs. They always tend to have this kind of problem. So you should be very careful of taking that medication unless you consult with your doctor for that. So how can it be treated? So for the blood pressure, like blood pressure means if the systolic blood pressure is 140/90, that's where that's a good thing for the normal person, right? And then they say, you should control it, like in a good control. And then if you are a diabetes, like they say, like 130/80, that means you should take some blood pressure medication for this, right? And the second one is the blood sugar control for people with diabetes. You should always be careful, like in the Indian levels, there's lesser than the fasting blood sugar should be lesser than 100 milligrams per deciliter, or 5.6 millimolars per liter. So in Western countries, they go for millimolars and everything. So smoking, like when you are smoking, like the tobacco products contains a lot of nicotine. So due to this nicotine, you always have kind of the kidney problems, and because the nicotine is high, that affects the kidney disease. And weight loss. Why you need the weight loss? Because especially from our Indian origin, like lot of people are obese, and once they don't do proper exercises, and now during the COVID times, and also they're sitting, most of them sitting, they don't have much of the place or anything, they don't want to go out. But you can do the exercise at home only, like climb the stairs. Last week my sister rang and I said, climb up to 3 floors and come down about 20 times a day. So that's also kind of exercise, you can keep doing it. And he was laughing at me, she was laughing at me, and like you can do any kind of exercise, even cleaning the houses, and keep you fit yourself, like if you're a obese person, to maintain the the BMI lesser than when you do the like if you have too much obesity, your BMI, you should keep it from 30 to 40 range of time, like to reduce the extra body weight. And keep track your medication, what you're taking now and what are you given. Like once you've been diagnosed with this kind of with the kidney disease, your doctor will give you some medication, but you should stop the other medication or discuss with the doctor that what can I take it, like whether is this medication is okay. And taking that, some people take the other medications as well, like Ayurvedic and all sort of other mixed together. Sometimes you have kind of reactions, and also you tend to have damage the kidneys. Education. Don't be afraid to ask questions about what's being done. Like that means, even though if you are educated or you are too highly educated, you should take some suggestions from your doctors or other people who have been so that whether what medication is right and which one is wrong, like that, and keep asking the questions like whether my blood results are okay, like how much I should take the medication. So that in this way, your kidneys can be treated in a way. How do I know if my kidney disease is getting worse? How do I know? Often it's very difficult to tell without getting proper blood tests. So the kidneys are like a garbage man. No one can notice them until they stop doing their job. So usually when they are high in urea and potassium and all sort of things, you can see if you know anybody of the dialysis patients or the kidney failure patient, they always smell high uremic, like very kind of foul smell coming from their mouth, and when they come nearby to you, and the sweat and everything. Only when the kidney disease gets particularly severe do most people develop symptoms like fatigue, malaise, very tiredness, and loss of appetite. They don't want to eat anything, and they lost their weight. They're losing their weight, and they taste a bit funny, like metallic, or some people they say chalky smell and everything. Like itchiness at the time, like itchiness represent the high uremic. That is the last stages of the the last stage of the kidney disease. Fluid retention. The other one is the fluid retention. Fluid retention means like if you see them, like they are having a lot of fluid retention in the face, swelling in the face, and mainly in the legs. So you can see them as bulgy legs with that. And the last one is the confusion. Like they don't know what they're doing, where they're going, where they're walking. They don't know what happened before. Like they forget things. So these are the things of when they're getting worse. So what about dialysis? Generally, when kidney functions decline lesser than 15% of the original capacity, people develop severe symptoms and need to start making preparations for dialysis. That means, as I said earlier, like when the functions is lesser than 15%, that's where your doctor say, oh yeah, you need to start thinking of going on the dialysis treatment, or some kind of renal replacement therapy. So your doctor, kidney doctor, will determine when it's the time to start the dialysis. To treat a kidney failure based on your symptoms. Symptoms means like if they're tired, or what are the symptoms, like how do they feel, and everything. And even the blood tests, all the blood chemistries will be high, urea will be high, urea in the blood will be high, and the potassium will be high. So that's the dangerous situation, even the results to death. So that's how we should be careful during this time when the symptoms are very bad. They need to follow their doctor. Now, what is dialysis? So the dialysis is the special technique. So the dialysis is a special technique of filtering and cleaning your blood of toxic waste products. So the two types of dialysis are there. One is hemodialysis, where I'm working at. I'm doing this job for a long time. And the other one is the peritoneal dialysis. So we'll go for that after this. So if you want to go for the hemodialysis, so the doctor, when I say like earlier, like if they want to decide already, you need to, so when the doctor says it's already 15% or less, you need to decide what you're going to do. Like if you have want to go for dialysis, so you need to create access for the dialysis. So there are three types of access. That's called arteriovenous fistula, and there's the arteriovenous graft, and the third one is the tunnel line or the catheter. So the first one, what is hemodialysis? Hemodialysis is a form of dialysis where blood is taken off your body, cleaned in a machine, and then returned back to you. Access to your blood is the key important, require preparation months in advance. That means, see, this is the hemodialysis machine. They formed an access here called AV fistula. So when you when they put two needles in and take one needles in the red thing we can see here, and then one to the machine, and then filtered, and then sent back to the blue color needle here. All right. So for this, so making this access, it takes nearly about 3 months. So this is called arteriovenous fistula. For the dialysis purpose, they create this one. So what is the fistula? Is AV fistula is called arteriovenous fistula. It's a surgically operated constructed direct connection between one of your arteries and the adjacent veins in your arm. So if you see here, they make an anastomosis, which the artery and the vein has been joined together, made an anastomosis, and then that creates an access to take the blood from here and pumps too much. When you see anybody having this fistula, you can touch the hand, and it's kind of buzzy sound coming on their hands. Like you can check it, like when they're having a dialysis patient or anybody of your relatives having this kind of issue. So so this is, you can see in the other picture here, where the artery has been the radiocephalic, radial artery has been joined to the cephalic vein and made an access to the dialysis. So these are the needles where we inject here, like put it here and then dialyze them for 4 hours or 5 hours or whichever time they've been prescribed. So these needles are the sizes, like 14 gauge, 15 gauge is a bigger needle, 16 gauge. And this is the 17 gauge is for the children or the little bit younger babies. Everything we can use this kind of needles. And the bigger, the smaller the size, the bigger the needles. Okay. So now, so how does it make is the fistula has been done in the operation theater. So it usually takes in the same day. in the general anesthetic or local anesthetic than in the theater. Once they've done the operation, this fistula takes about nearly about 4 to 5 months, like developing time. Like then only we can use it. So when you can't use it before that because it is not developed access for the machine. So there's another form of access called AV graft. So AV graft is a surgically constructed connection between the artery and the vein using a synthetic material. So the synthetic material is looks like this. All right, it will be situated under your skin. So the needle looks like this. Can you see me? Yeah. So the needle looks like this. So it goes inside one side as taking to the machine, and the other needle goes the other way. So that's how we put them on the machine. So this is the synthetic bridge graft. So this is also same like they did do in the surgical procedure in the operation theater by a surgeon, and then they put a synthetic tube here. Can you see that? And one side the blood is taken to the machine, all right, and the other side is given back to the patient. So you can see this one. The too much pressure is called the arterial one, and the little pressure one is called the vein. So it's been returned back to the patient. So this procedure takes nearly about 4 to 5 hours of time. So they have to come 3 times in a week. So this is how we do it. So now in the early stage, when the doctor decided that you have to go on the dialysis emergency, so they don't have the access, because even if they have a maintained access, they should wait for 3 months to that access. What I said before, these 2 access, they can't use it straight away. They should wait for 3 months to get maturity and then needle. So what we do now, so this is called the tunnel catheter. So that's how they use in the emergency purpose. So how do they use this? This is called the catheter here. The catheter is placed in the major vein, like a subclavian vein. This is a subclavian vein. All right. A vein in your neck and tunneled under the skin on your chest. It doesn't require a surgery, but usually a radiologist or a surgeon can do it using a dilator and then a guide wire. They put a guide wire, like once they inject in the needle, and then they put a dilator, and then they put this catheter inside here, right? So that the dialysis to work, it must be a way for taking blood from the body to the dialysis machine and back to the blood, like the same procedure as I told you in the AV fistula. So one side we take the blood, and other ones we give it back to them. So these catheters always have the infection rates higher. Now they have another access called the perm cat. So the perm cats, as we proved, like they can stay there for 2 to 3 years, like more than that too. Like I've seen people having from 5 years staying here in their body, looking after well. All right. So when they're having a lot of infection, like when they're having this kind of catheter, they should be careful when they're going to the swimming pools, or they're going to the public pools, or where any kind of public places which a lot of pollution is there. They should be careful and to avoid the infections. And this is the best option, that avoid being the long-term option. But they say that they don't want to leave this, especially when they put the jugular vein. The jugular vein, they put it here on the top, so they won't leave for a long time. That's for the emergency purpose they do. So usually the hemodialysis is done 3 times a week, as I said. Like so they should come 3 times in a week for 4 hours to 5 hours. Right. So this is the other form of dialysis called peritoneal dialysis. So you can see this peritoneum there's a catheter here inserted here, and there's a connector here, right? So this connector will be staying in the body. So this peritoneum will act like a permeable membrane, and the dialysate solution is specially prepared like different kind of concentrates according to their body. Like the doctor will prescribe like what kind of how much percentage will be concentrate will be given to the body inside the peritoneum and placed there for 4 to 5 hours, and then once this the thing is gone inside the locket, and then after that, after a few hours, you're going to drain back that solution, right? So this is a form of dialysis where the fluid is installed in your abdomen and waste product diffused from your blood of the fluid across the peritoneum over several hours. Like several hours, like usually they do it about 4 to 5 hours. The fluid is then drained from your abdomen, as you've seen in the procedures, and then it's going to be drained. Access to abdominal cavity is the key. So the patient perform usually 4 to 5 exchanges in a day. An exchange consists of installing dialysis solution in the abdomen and letting sit for 4 to 6 hours. Then the solution is drained out, and the new solution again put it back inside. And the process keep cycling, right? And how do you get access to the abdominal cavity? So they do this surgically install this catheter, and it looks like this. So they always have a dressing on it, because they should not go to the pools, and they should not go to outside. Like when they're going to public places, they should cover their thing in a very safe plaster and all sort of things, and go like especially when they're going out or in polluted places. So this catheter has been how they install this catheter is same like the surgeon will install in a same day procedure in the operation theater. It normally, once they put this catheter, it usually takes about 2 to 3 weeks to operate to function this way. Now, so there's another form of dialysis, like peritoneal dialysis, same like peritoneal dialysis, is called CCPD, or it's called as a continuous cycling peritoneal dialysis. So what does this one do is the automatic machine is done in the night time. So once you sleep and connect and sleep, that will, the form of peritoneal dialysis in which exchanges and performed by a machine at night while you are sleeping. During the day, the dialysis solution sits in your abdomen, but no exchanges are taken place. So this one, like some people, they like it to do it in that way so that they can work in the daytime, and the nighttime they come and connect to this machine and dialyze like CCPD they call us. Some people they prefer this kind of peritoneal dialysis unless if they are very particular like aseptic technique and everything. Usually they always have this kind of problems like when they're having here, when they don't look after it, and they easily catch the infection called peritonitis. So peritonitis, then they can't do the dialysis properly. The peritoneum will not act when you got infection. So then they need to be removed the catheter if they're not, if there is a lot of infection in that thing. Their temperature will go high, and then and they can't cope it up, and they'll get more sick. Now, come to the home dialysis. So, so dialyzing at home, like so, how do they dialyze and what they dialyze? How do they dialyze things? So, in dialyzing at home is more advantageous because these days, like, and they can dialyze at any time they want it. Like if they're working in the morning, if they're late, no need to wait for the hospitals. Like hospital, you have a fixed time. Like morning 7 o'clock, you can go. You should go there at morning 7 o'clock, and like that. There's another form like nocturnal dialysis. Nocturnal dialysis means like night dialysis. So night dialysis, they will have a slow pump speed and dialyze for 200 to 200 ml speed for longer hours. That means they do 6 hours, 7 hours of the dialysis time, so that they feel much better in the during that time, and saves travel to the hospital unit, because usually these days during the COVID time, like I heard from some of our friends that there's a lot of problems with the transport, and people don't allow them to go, and then they had beatings and from the police and all sort of things. So I was told in one of the some of the my junior staffs in India that they are very scared to drive, and even many people have died without dialyzing during the COVID time, because they can't come out. There's nobody to take them. There's no autos. They can't travel. The drivers won't come to take you, anything like that. So this in this situation, the people better to dialyze at home. So how to dialyze at home? Like this kind of conventional home dialysis, you do 3 times a week or for 3 to 4 hours, like a short time. Like they do 3 like instead of dialyzing long hours, they do short hours, like 3 or 4 hours, and you can choose your time. Like for dialyzing this, your partner or your husband or wife, they will give a training for 6 to 8 weeks in the hospital. Like they will train to set up the machine. They'll train to needle. Like if the husband was dialyzing, if he wants to train to needle, like they will train for at least 3 months how to do it, and then after 4 or 5 weeks, they will allow them to be independent in the hospital itself, and they train them for nearly 6 to 8 weeks, even longer sometimes if they are a little bit weaker in handling this things. And short daily home dialysis, this is usually done 5 to 7 times in a week using a new machine designed for short daily home treatment. Usually it lasts about 2 hours each, and the caregiver will be trained. But for me, I think it's dialyzing about 4 hours, 5 times is much more enough. So to this one, they say that they reduce the symptoms like headaches, nausea, and cramping, and feeling washed out. Like usually what happens when they're taking when they're dialyzing, they remove the fluids. When they remove the fluids, they feel very tired because their kidney is not functioning. All their waste products will be accumulated in the blood, and so that's how they feel. When they're doing at home, they should be careful, like what they do, like how much fluid they're taking and everything. Nocturnal home dialysis, as I said, like is night dialysis, long show treatment done at the night while you sleep. You may do this 6 nights every week rather than or every other night, depending on what your doctor prescribes. Like say doctor say, like you can us here, like many people, they do 6 hours in the night, and they do for 4 days or 5 days. Instead of 3 days, they will do more so that they keep more fit in the daytime. The treatment that there will be like always there should be a partner or somebody watching you when you are at home. Some centers monitor your treatment by sending information by your dialysis machine to staff location by telephone, modem, or internet. More hours of dialysis each week can result in more waste removal. So sometimes when you are dialyzing at home, there will be a monitor kept by your like a nurse or somebody who is in charge for you in that certain hospital you belong to. So they train you. So they will keep an eye on you. Like if there is any problem or something like that, like they monitor you, and then now they video call you and say, like if there is any problems or troubleshooting in a machine or something, like they take like a video call or a WhatsApp video call and say, oh, this is where you've gone wrong, like you can fix this one and fix this one. Especially for the needling problem, they can't do anything, so they need to look for the expert for if they are having any needle issues. It is also possible to combine daily and nocturnal home dialysis. Whether you can combine treatments, it depends on your needs, your medical condition, and your machine. whatever treatment option you choose, it's important to know that if you are getting the right amount of dialysis, this should be done regularly to check the amount of dialysis you receive. So that means, like, usually when they are dialyzing at home, every monthly they do the blood test, they do how good you're dialyzing and how well you're dialyzing at home. Like they take the monthly bloods and send it to the lab or the particular hospital where they belongs to. So added benefits of short and daily nocturnal home dialysis. Many reports say that indicate that the people using short daily and nocturnal dialysis take less medication to control blood pressure and anemia. So that means, again, like they should always take, once you are on the night or dialyzing at home, like you should take your blood pressure pills properly and check your blood pressure all the time and take your medication. So you take less medication to keep phosphorus under control to help prevent bone disease. Have improvements in neuropathy, like they're feeling much better, like when they're dialyzing 4 to 5 times in a week, like they find much better. Sometimes they should depend, like how much fluid they're gaining. Like if they're dialyzing every other day, like they only put on a little bit of fluid in, so they don't take off much. So that's how their energy levels comes up, and they can sleep better. They don't want to go to the hospital after once they go to the home dialysis, and the quality of life is better and live longer. Like as I say in the earlier class, like I have seen people, a patient from Sydney, like he's dialyzing from 1972, so that's almost 48 years, like and nearly 48 years he is dialyzing at home dialysis. He is with his partner, staying in a remote area of Sydney, where about 50 to 60 kilometers, I think, for the hospital. So he does at home, and whenever his problems, they have like a 24 hours on-call chat. Like he mentions to the nurse who is looking after him in the hospital, like this is the time I'm going on the machine or something. Like they talk and they say that I'm going at 10 o'clock in the night, so they'll keep an eye on you, and whatever the problems, they'll troubleshoot you over the phone or something like that. And their quality of life is better. And also some people, they dialyze in the caravans. You know, caravans, like especially the Western country, they put a machine and there'll be a small arrow. I show you the arrow, like it's called reverse osmosis machine. So they take the machine in their van. It's called a caravan like thing, and then they have a bed and everything inside, and they can drive around the country and then dialyze wherever they want. There will be a special tank of water, so they can fill that water, and there will be a more filters situated in the water filters. I'll show you the next the water treatment, how it has been done, the water treatment. And so advantages and disadvantages of the home dialysis. Home dialysis means there is especially this condition apply for India, because disadvantages means there's a lot of power supply, and the power cut especially happens in India, and also the water supply, things like that. So now what happens, like you can for the power cut, like you can use the automatic power generator that now you all know that you can use it for hours together, like without any power cuts. Inlet water supply, if there is no water supply, they can, they always make sure when they're dialyzing at home to make a separate water tank, with filters situated next to the tank, and I'll show you what kind of filters we use in the later thing. Absence of a caregiver, like if your family, if their caregiver, like his wife or husband or not there at present when they're dialyzing that day, but there should be somebody standby, like a relative or a caregiver or a staff member, to help or a regular phone help. Sometimes if you are expert, if that person is a very expert, then he can dialyze themselves at home. and they can have always a standby, like instead of any accidents happens. So that one. So quality of the water checking, like if they're very poor quality in that area where you live, like always better to check the water hardness and chlorine test to be performed before dialysis. But that's a must. When you dialyze, when you go on the home dialysis, we should check the water every day before the treatment when you go on the dialysis machine. So this is how the water filter. This is the machine, the dialysis machine, and this is the water filter. So it looks like this, and there's three, like one is 0.5 micron and the two are 0.1 microns filters within the this is called the portable reverse osmosis water machine or water filter. So this will be connected to your main water supply. So this is the small machine that can be used at home. So hope everybody will understand this one. Okay, any questions? So you want me to finish the other one and then take questions?
Yes, sir. We'll finish off that also.
Okay. Okay. Right. Now, so for so this, what I said before was only the one machine one. Now I'm talking about the hospital dialysis and the water treatment for the hemodialysis. Like usually, water is more important for the dialysis patients. Like sorry, this what is. Sorry, just a minute.
Anusha?
Hello, sir. Any
Hi.
problem, sir?
I'm going to get some water.
Yes, ma'am.
Okay, sir.
I think sir should maximize the screen, right?
Yeah.
Ah, yeah.
What, Rebecca?
Yeah, it was
Maximize.
Slide show photo, sir. Ah, sir.
right show, sir.
Ah, yes, sir.
Okay, na? Okay.
Done.
Sorry.
Yes, yes, sir.
Sorry, I just went to get some water.
Yeah.
That's okay, sir.
Okay, sir. Yes, sir.
Okay.
Proceed.
Water treatment. Okay, water treatment for dialysis. Like it's very important thing. If you for the dialysis patient, everybody needs every machine needs the water. So this is the one of the dialysis unit where usually the main in the dialysis there are about more than 20 to 30 machines in the main units, like especially in the Bangalore or anything like that. In Manipal, where we used to work, like there should be about 30 machines or something. Now it will be more. So water treatment is very important because for the dialysis treatment. So in survival of hemodialysis patients is steadily improving, increasing problem due to contaminants of the dialysis water, because the tap water is too much contaminants coming from outside. So all kind of contaminants, I will explain to you that one. So hemodialysis patients are exposed 25 to 30 times more than the normal person of water compared to the normal individuals. We drink water for 2 liters a day. For a week, we drink about 14 liters of water a week, whereas the hemodialysis patient is being exposed to water like about 25 to 30 times. That means nearly 350 to 400 liters of water they will be exposed to. And in the tap water, there will be a lot of contaminants. So that will enter the blood compartments of dialysate and accumulate in the body. So water treatment is used for preparation of dialysate. Is probably the most neglected area of renal replacement therapy with the dialysis. Quality of water contributes very significantly in acute and long-term morbidity and prognosis. So if you see, as I said, like every average person drinks 2 liters of water, like 14 liters of water a week. Whereas the dialysis patients in a treatment, like they do 120 liters per day, and 3 times means like more than 360 liters, depends on the time of the treatment. Like a normal person, like they excrete toxic substances in the urine, whereas the dialysis patient, the kidney is unable to excrete toxic substances. So there's a contaminant selectively absorbed in the GI tract for us, like indirectly exposed to the blood. But for the dialysis patient, the contaminated directly exposed in the blood or to be removed by the dialyzer membrane. So this is how the water exposure about the normal person like us and the kidney patients will be exposed this much, like 25 to 30% of the water. So number one, there are four groups of them. So this toxic contaminants in the water, like aluminum, chloramines, fluoride, copper, and their levels of the concentration levels of those ones things. So these are the like copper, zinc, nitrate, sulfate, calcium, magnesium, and sodium, and the microbial contaminations will be there in the normal water. So in the drinking water, you can see the barium, chromium, silver, mercury, selenium, lead, cadmium, and arsenic. So many years ago, the AAMI standards, that means the Association of Advanced Medical Instrumentation, they made a standard protocol to all the dialysis units should follow that protocol. So that's a global standards. In this one, the drinking water is 10%. They allowed us the AAMI standards. So now the third group is the physiological one, like calcium and sodium and potassium, which is the main physiological contents in the water. And the fourth one is the bacteria, endotoxins, and the bacteria like the products, like what are the bacteria in the bacteria in the water, like the endotoxins. So the bacteria is the main thing, like should be treated. This in the group of the microbiological one. So the water treatment plants look like this. I think my diagram is not so good. Like the inlet is coming, and the sediment filter is here, and that takes off all the sediments, and the carbon filter. The next one is the carbon filter. These two are the carbon filters, and the next one is the softener. And then after filtration, there will be a lot of monitoring, the pressure monitorings, and then goes to the reverse osmosis plant, reverse osmosis machine, and then reverse osmosis. From there, the filtered water goes to a tank, feed water, and then this takes to all the dialysis stations. Now, so what happens? If there is a lot of toxic effect of the water contaminant in the hemodialysis, if there is a lot of aluminum in the water level, this you have a dialysis equilibrium or renal bone disease, and even the patient will die. And if there is a lot of calcium and magnesium, they will have high blood pressures or low blood pressures and hard water syndromes like that. And if there is a lot of chloramines, there will be hemolysis, like there will be a lot of blood clottings in the dialysis, and they lose a lot of blood and anemia, methylglobinaemia, like that. So if there is a lot of copper, they always feel nausea, headache, liver damage, and also they can die. Like too much of fluoride, you have osteomalacia and osteoporosis. Yeah. And if there is a lot of sodium in the water, you can see that a lot of high blood pressure and pulmonary edema. Pulmonary edema is the same like high, like too much fluid in the lungs, and they get a lot of confusions, and they go into seizures and all sort of things, like too much headache and even go to coma. Microbial, like bacterial things, fire reactions, chills, fever, and shock. And too much nitrate, you say methylglobinaemia, hypotension, and nausea. Like that. Too much iron in that hemosiderosis, too much sulfate, you get nausea, vomiting, metabolic acidosis. Too much zinc, you get anemia, like a low hemoglobin, and they get vomiting and fever. And aromatic hydrocarbons, potential chemical carcinogens, like they have cancer things for that. So why it happens, like in many parts of the world, like if they are very negligent of the dialysis water, like too much of dialysate aluminum is there, is even the fatalities happen in many dialysis units around the world. Has happened, like especially 8 cases of fatality and simplicity observed this was long time ago, and even now, like many stations in many dialysis unit, like lot of fatalities has happened, coincided with the addition of aluminum sulfate and sodium aluminate in the city water, resulting in the dialysis fluid. The aluminum concentrate will go more than like 200 to 1000 units per gram. The outbreak ended after installation of the deionizer, so that reduces the aluminum in the water. I show you the things later on. So even if there is a lot of other microcytins during the renal dialysis treatment, they have a lot of experience in visual disturbances, nausea, vomiting, and muscle weakness following the routine of the hemodialysis treatment. For example, when I was working in India, also there was some accident happened where there was no water supply, and there were 10 patients dialyzing at the time in one of the big hospitals where I was working. Then we couldn't leave the patient because there are already 10 patients on the machine, and one of the nurse and I was on duty, like, and all of a sudden there was no water coming to the dialysis machine, like, and then we have to call the plumber, and then plumber went and opened the tap upstairs, and then the water came in, and then we tried to put all the patients on, and once we put the patients on, after 10 to 15 minutes, everybody started vomiting and diarrhea and nausea, and everybody has got low blood pressures and everything. So we couldn't know what happened, like, because all of a sudden water has come, and then once one patient started, 2 patients vomited, and 3rd patient, everybody were attending. So, and then all of a sudden, what we have to take the patients off the dialysis machines, so we have to take very fast and close the dialysis, stop the dialysis, and then me and my other colleague, we went upstairs and saw there was some what that plumber did was instead of connecting the connection to the RO machine, what he did, he redirected to the dialysis unit straight away without any filtration of the RO water. So that created the accident. So So this case, if we live a little bit longer, the patients will die. So these are the problems of all over the world. Like many patients, if they're not taking care of this RO water or the deionized water, they will be always having the problem. So now, how does the water treatment look like? So water treatment will have a bad water supply from outside, like a city water, like you guys have a Kaveri water and all sort of water, like sometimes you have a borewell water or even the river water. In every parts of Karnataka, you have different kinds of water supplies. So that's the main water, and the second one is the backflow preventer, and the temperature bending valve, the booster pump, an acid injection metering device, multimedia depth filter, and the water softener, and the brine tank, carbon tanks, reverse osmosis system, reverse osmosis membrane, deionizer. That not many units will keep the deionizer, and the distribution system. Okay. So what is the purification process? What does it do? So in the carbon tank, like in the carbon, like they clear up all the chloramines and the organics. The carbon it absorbs all the chloramines and the organics. Whereas the softener removes all the calcium and the magnesium. Whereas the reverse osmosis, it takes off all the ionic contaminants and bacteria and the endotoxins. Even the deionizer, like ionic, it takes off the ionic contaminants, whereas the ultrafiltration, it removes the bacteria and the endotoxin. These are the levels of the chemical quality standards of the water used in hemodialysis in the United States and all parts of the world. They follow that AAMI standards of that called the American Association of Advanced Medical Instrumentation, AAMI standards, and it's like a global standards. They follow every unit. So usually they recommend maximum levels of microbiological contaminants in water used for the hemodialysis. So these are the Canadian Association. The bacterial should be like this much of CFU per ml. The CFU means colono forming units per ml. So these are the Japanese society. They all follow according to the AAMI standards. Yeah. So this kind of this is the systematic drawing for of the water treatment for hemodialysis. So this system, if you have a dialysis unit anywhere in the world, they should follow this kind of systematic diagram for the dialysis patients. So how does it do? Like the water comes from outside, like Kaveri water or whatever, like whichever wherever you come from, and then it goes to the before entering. There will be a temperature valve that maintains the temperature of the water, and in the in-depth filter and the carbon filter, and then comes to the softener, and then comes to the reverse osmosis. So what is the here the sediment filter? It is called also the depth filter is called a sediment filter that removes all the sediments. All right, and the carbon filters removes all the chloramines and the organics and everything. Once it comes to the softener, it removes the calcium and magnesium, and there will be another booster pump to pumps to the reverse osmosis machine, and the reverse osmosis removes all the ionic contaminants and the bacteria and the endotoxins, and then it gives to the deionizer. So the deionizers removes all the ionic contaminants, and finally the bacteria filter removes the endotoxins in this filter. And then after all that, it goes to the storage tank, and then the storage tank, from there it goes to the dialysis stations, dialysis chairs, where the patients can have the dialysis treatment. Yes. So water supply. There are two sources of the water supply. Like you get it, the Kaveri water and the surface water and the groundwater. Surface water is generally more contaminated with organisms and microbes and industrial waste, fertilizers, sewage, and all sort of crap you get in the surface water. So the groundwater is generally lower in organic material, but contains higher inorganic ions such as iron, calcium, magnesium, and sulfate. Right. So the backflow prevention inhibits flow back treated water into the municipal water. Like once the reject water is coming, inhibits the flow. Once it's come back from the loop, it will come back to the tank where the city water is kept in the big tank. And the other one is the temperature bending valve. Brings water to standard temperature of 25 degrees for proper function of the RO. They always maintains the temperature because the temperature bending valve, every country is maintain the temperature wise. Like especially if you are in Delhi or some other cities like that, the temperature goes up to 40 degrees. I think so. They want to maintain the temperature for the dialysis machines around 25 degrees centigrade to proper function of the RO. Especially where I come from, like sometimes the temperature goes outside about -1 or -2 degrees. Where I'm here, like last week went to 3 degrees. So this during that time, so this temperature bending valve, like this is more important thing to maintain the temperature of this RO system. All right, and the other thing is the booster pump. The booster pump will pump from outside to maintain the adequate flow pressure of the water, so that the system operate smoothly. For example, like if there's no system, if they don't pump the system, it will always have a airlock, and there won't be any water coming to the RO machine. So that's why they usually have two booster pumps to pump to the RO machine. So these are the reverse osmosis machine, and this is the reverse osmosis plant. So they monitor all the things in the new machines we have. In our machines, we have a screen here that says if there is any regeneration has not taken place from the softener or the carbon filter, not the regeneration has taken in the night time. It will always say that, and the alarms will come up like with red lights, like this thing is not done properly. Acid injection machine meter, by increasing the pH of the city water, like using a lime softening agents, calcium carbon, to prevent leaching of lead copper from the piping system. So always when the city water comes, calcium carbon, like leaching the lead copper from the piping system, always happens like that. So for proper function of the RO and carbon tanks, incoming pH water should be maintained between 5 to 8.5. So that's how they always have to mention, or else if the pH is too high, and then you're going to have the proper, you're going to have a lot of problems. Now, the other filter is the multimedia depth filter. There will be large particulates of more than 10 microns, such as dirt, are removed by the multimedia depth filter. Flocculants can clog the carbon and the softener tank. So, as I said, and contains multiple layers of the various size rocks that trap the large particles as the water filtered downwards. And this is the carbon filter. So what does the carbon filter do? So when the feed water comes in and removes all the chlorine and the chloramines, and then it goes to treated waters, and then it empties, things. So these are the when the chloramines and organics has been removed, it absorbs all the chloramines and the high level oxidates chemicals. They will be absorbing in that carbon tank, and they are added to the municipal water system to kill bacteria, but they are also cause the hemolysis. So you can't give this water straight away to the patients. So it looks like this in our unit. Okay, and then the water softener, like what does the water softener do? So mainly water softener removes like calcium and the magnesium and all sort of things. So water containing calcium and magnesium from deposits on RO membrane. So softener works on ion exchange basis. The resin beads within the tanks have a high affinity of the cations, calcium and magnesium divalent present in the source water, and release 2 sodium ions, monovalent for 1 calcium or magnesium captured. So this is the called as the brine tank where we put the salt and connected it to the water softener system. So water softener needs regenerating, like every night, like every 12 hours, every 24 hours it needs regeneration to be taken place. The softener needs regenerating on a routine basis with the concentrated sodium chloride brine before the resin capacity is used up. The resin is backwashed to loosen the media and clean any particles from the tanks. After the backward washing step, the brine solution is drawn to the tank. So these are the 2 brine tanks there. Now, pre-filter of the reverse osmosis treatment. The pre-filters are particulate filters positioned immediately before the reverse osmosis pump and membrane. Carbon fines, resins, beds, and other debris exerting the pre-treatment could destroy the pump and RO membrane. So before going to the RO, they will be filtered here. So if you can see this RO, like all the red one will be drained. The pre-filters, the filters are 3 microns or to 5 microns filters which will be inside these filters. So this is the final filter which removes all the bacteria thing. So reverse osmosis is natural osmosis by forcing feed water under pressure through a semi-permeable membrane, leaving contaminant behind ions and organics. Now it looks like the membrane looks like this, like the RO membrane, most important component produces purified water through RO. Polyimide thin membrane, most commonly, like there will be a lot of membranes surrounded in the reverse osmosis filter, and they reject water into the drain. Now even there's a lot of water going to the drain, like after filtering the reject water is too much. In many units they are recycling that water to the plants, or you can use it for the toilets and all sort of things, or even to wash your car and all sort of things. So that can be used of the reverse osmosis drain water. So this is how the machine overall looks like. Inside will be the reverse osmosis machine. Deionizer, like deionizer do not remove non-ionic contaminant bacteria or endotoxin. Cations, resins contain sulfuric radicals and exchange hydrogen radicals of other cations such as sodium, calcium, and aluminium. Anion resins contain ammonium radicals which exchange hydroxyl ions from chloride, phosphate, and fluoride. So what does the deionizer do is it removes the main ionic contaminants in that one. So these are the bacterial filters, the post RO, and then will be sending to the through the dialysis machines after it's been filtered here. Distribution system, RO distribution system, direct feed and indirect feed. The direct feed directly delivers the product water from the RO unit to the loop of the for distribution. The indirect feed involves a storage tank that accumulates the product and delivers to the distribution loop. Unused portion of the circulated back into the storage tank. Like once the water gone to the loop to the dialysis patient, and the remaining water come from the loop will come back to the recirculation storage tank. Distribution piping systems. A continuous loop design is recommended by standard AAMI. No dead ends or multiple branches because a lot of bacteria will form, so they won't have any dead end or multiple branches going here, going there, and everything. So maintenance of water quality. The key of maintaining water quality is the establishment of facility specific quality management program for the water treatment and distribution system. It should detail maintenance practices, describe the structural monitoring of programs designed to verify the satisfactory operation of the system. The quality management of the system should be fully documented and clear, delineated lines of responsibility. Like every day, as soon as you come into the unit, like one of the staff member has to do the water quality check. Like they do the hardness of the chlorine and also the softener. So we do the hardness, and finally we do the bacteriological tests. Every month we do the bacteriological test and we send it to the lab. But as soon as the patient going on the machine, before that we do the hardness test for endotoxins and also like if there is any problem in the softener or something like that, like we can't put the patients on the machines. So we should be always careful that because there are more than 15 patients on the machines where I am dialyzing. So, and also if you see some of the big hospitals like Manipal or something like that, there will be 40 to 45 patients on the machines each time. So the water treatment always should be carefully handled and treated to the patients. So the endotoxin standard, the maximum level of endotoxin in water used to prepare dialysis fluid must not exceed the AMI standard. Usually this 0.25, like our one is 0.00, so 0.01 EU per ml. So let's say the allowed level is more than 0.2, then you need to regenerate the softener and the whole system. Frequency of testing for bacteria and endotoxin levels. Testing should be performed monthly for the endotoxin levels. We send it to a special lab here, and then we do that. If standards are exceeded, testing should be performed weekly. Like if there's any problem, like a softener not regenerating or the carbon filter not working properly, there'll be the meters will say like there'll be a monitor there on the top. The monitor there, so it will be having a reflection that this is not working, or whichever monitors are not working. So we can see that there is a problem there, and the alarm will go on to every unit. And also there will be alarm in the main RO reverse osmosis system here in the monitor, like that it's not what time it got regenerated and what time the RO system got heat disinfected and what time the softener regenerated. All the details on every daily basis, it will be there. So the staff or the technologists or somebody who comes in the morning who is on shift, so they have to check and record the logbook and do the readings. So this is called reverse osmosis water, and also called as ultra pure dialysis solution. It decreases CRP and IL-2 6. Improves the response of EPO, like the patient's quality life will be very good doing that one, and better promotes the better nutrition, reduces plasma levels of beta-2 and microglobulin, slow loss of residual renal function, lowers cardiovascular mobility. Like once they are on regular dialysis and with a good quality of water, they always can live longer. And also the bacteria level below 0.1 CFU per ml, and endotoxin levels are below 0.02 EU per ml. Conclusion now. The water treatment is generally neglected area of the dialysis therapy. Like in many parts of the world, there's always a problem with the water quality. Like the RO systems is not maintained properly, not regenerated, and all sort of things. So due to increase of survival of dialysis patient, increased use of bicarbonate dialysate and high flux membrane, water treatment has become essential. Usually we have for the dialysate solution, we use the bicarbonate dialysis for all the patients now. I don't know about India. Like I think in India, like many people use the acetate kind of dialysis as well, but they will be always having the vomiting sensation and all sort of things in the acetate dialysis. So they use the bicarbonate dialysis, and also high flux membranes. High flux membranes is the bigger capacity of the dialyzer membrane. So they use that one, and the water treatment has become very essential. It is worthwhile achieving the goal of sterile, pyrogenic free, and chemically pure water for dialysis. The above goal is achievable with a combination of various technologies available. After designing and launching the appropriate system in hemodialysis unit needs, it's essential to monitor the effluent water regularly. Thank you. Thank you.
Yes.
Madam, can ask
Yes.
some.
I think you can stop presenting, sir, and you'll be seen completely. Just stop presenting, sir. Okay. Next, we'll go to QA session. I thank sir for this wonderful session. So there are a few questions in the chat box, and just read it to you. I think the first question is from Raj. What is end-stage renal disease? Is there a cure for CKD? What is end-stage renal disease? Is there a cure for CKD?
What is end-stage renal disease? What is the cure for CKD?
Yes, yes.
End-stage, like a chronic kidney disease, like usually end-stage renal disease is the where the patients will come to from acute to chronic, depends on their blood levels and blood chemistries. Once their creatinine level is very high, and the urea and the blood urea nitrogen is very high, and then the doctor will say like to go on the dialysis unit. So that's called end-stage renal disease.
Okay, thank you, sir. There's one more question. How is diabetes control related to kidney function?
How is diabetes controlled? Usually when you are diabetes, like they should take proper insulin. Like especially many people are scared of taking insulin because of the injections. Even though if they're high blood sugars in the bloodstream, they say no, I don't want insulin, so I'll go on the tablets. Insulin ಬೇಡ ನನಗೆ, ನಾನು tablet ಅಲ್ಲಿ ಇರ್ತೀನಿ ಅಂತ. So many people, even many of our family people, like say, oh no, I don't want injections. So they stick onto the tablets. So in that way, that the blood sugars are not controlled. In that stage, it's very important to take the insulin and to control their blood sugars when they are on, and having their problems. Thank you.
Thank you, sir. Hope your question is answered, Raj. We have one more question from
Sir, sorry to interrupt. 1 minute, Jyoti ma'am.
Yes.
Sir, sorry to interrupt you. So, present now, stop my distribution.
Sorry?
Sir, stop presenting.
Presenting na stop ಮಾಡಿ sir.
Oh,
You just click on stop presenting.
stop ಮಾಡ್ಬೇಕಾ? Close ಮಾಡ್ಲಾ?
Yeah.
It's okay?
Stop presenting ಕೊಟ್ಬಿಡಿ sir ಅಲ್ಲಿ.
Yeah, okay.
Meet
Stop. Okay, stop presenting.
ಇಲ್ಲಿ Google Meet ಅಲ್ಲಿ.
Okay.
Yes sir, done sir. Fine.
Yes, sir. Fine. So we have one question from Shobha. Does consuming highly proteinaceous energy drinks cause any damage to kidney?
Yes. As somebody also asked before this question, because usually when they go to the gym, like if you have one pack, they want to make 6 packs within 3 months' time. So, like if they are already obese, they don't want to reduce the weight. They want to take all this high protein diet. So in this case, I think many people have fallen into acute renal failure, followed by the chronic renal failure, I think.
Okay, thank you, sir. There are 2 questions from Sujata Mohanty. Even patient doing dialysis die. Why?
Oh, there'll be a lot of complications, as I said earlier, like diabetes, hypertension, which all leads to so many issues, like even hypertension during dialysis and cardiac problems will have, as long as they've been monitored closely. Usually it won't happen on dialysis, but when they have severe heart conditions and diabetes, they will die. Not really, like usually the people looking after them are very careful, like as soon as they go very hypo, they'll be knowing, like, oh yeah, this patient is going very low blood pressure or low blood sugars or something, so they will treat immediately. So if can't be done, but rarely happens on the dialysis. They usually taken to the intensive care or something like that, then they will monitor there, or they will die there or something. Yeah.
Thank you, sir. So one question from Shiv Kumar. Once the patient is on dialysis, will it be treated back or reversible? And can the patient will recover? He'll become normal?
Sorry, say that again. Once?
Yes, once the patient is on dialysis, if a patient is put on dialysis, it is taking him through the lifetime, or can he come back?
It depends, like in the beginning, they treat as the acute renal failure, like when they are in a septic shock or something like that, during the accidents or anything like that, like especially when the patients are in the intensive care or having other form of very sickness, they fallen into acute dialysis. When they are in acute dialysis, they do dialyze on the machine, but that doesn't mean say that they can stay for a longer time, but they can be stopped after their kidney functions starts normally.
Thank you, sir. What are the cleaning procedures for dialysis? What types of chemicals are filtered? I think it is answered in your presentation.
So can you see? So this is called the dialyzer. All right. So you mean to clean this one? So in India, they reuse this filter for about 8 to 10 times. So in many parts of European countries, they don't reuse it because of the manpower. They have a single-use system. All right. So usually once they fill, when I used to work in Bangalore, we used to reuse the whole system, like even the tubings and the dialyzer, everything. So this dialyzer can be reused 10 times in some of the Asian countries. Even Singapore, they reuse, and in many parts of America, they reuse, and there's a special machine to reuse it, and then they filled up with a chemical called formalin and other form of chemical, and then they store it in a special place. Once the patient comes, they use for the same patient. After cleaning draining that chemicals back, and they flush with the saline, 2 liters of saline for the whole system, and then they reuse for the same patient. Does your question answered?
Yes, sir. There's one more question from Anita P. Sir, I underwent treatment for CKD at Manipal Hospital. I had reached almost last stage, but doctors decided that she's not responding properly. But like this, she was on treatment for 2 years, taking injections and steroids with other tablets. Now her question is, with allopathy, can she go for herbs like Punar, Nava, Bohevia, Boswellia, and so on? Will it be having some side effects to her?
Once you are taking the English medicine, sometimes will have a side effect with the other homeopathic and other tablets, other medication. But some in the rare occasions, some people will get away with it, and they will be okay. But it's very hard to say. But I'm not supposed to say that whether that is allowed or yeah, they should consult their doctor. So I'm not qualified for that question. So it is not my scope. So they should contact for that, for that particular question. Thank you.
Okay. Thank you, sir. We have a lot more questions. So for which I request the participants will be given an email ID of sir.
Yeah, please give me. I think you can give my email ID so that I can answer the questions.
Questions? Yes.
Yeah.
So last one question from my side. My question is on AV graphs, sir. Acceptance rate. I just want to know what is the acceptance rate of AV graph, and what you have to say with reference to tissue engineering. Tissue engineering. So I have a question with reference to animal cell culture. What do you have to say with tissue engineering? Will it be a promising field?
I didn't get you. Sorry. Tissue engineering.
Yes, where they create artificial kidneys and implantation of that with reference to transplantation.
Yeah, okay.
Yes.
Even for the transplantation, animal kidney?
Yes.
Or the study going on, you mean?
Yes, study going on.
No, I didn't come across about that one much, but I think I heard that there was a study going on.
Okay.
Yeah.
Okay. Thank you, sir.
Yeah.
Yes.
Thank you.
Yes. Thank you for your Q&A session.
Yeah.
Now I request Srimati Saraswati T, Principal, SJR Rajaji Nagar PU College, for her presidential address. Over to you, madam. Saraswati ma'am, I request you to take over, ma'am. It's not audible.
Now,
yes, ma'am. Audible.
am I audible, madam?
Yes, ma'am. Now you are audible. Yes.
ಜ್ಯೋತಿ ಮೇಡಮ್ ಮತ್ತೆ ಕೇಳ್ತಾ ಇಲ್ಲ ಮೇಡಮ್, ಮತ್ತೆ ಕೇಳ್ತಾ ಇಲ್ಲ.
Saraswati ma'am, I think you have to check for the connectivity, ma'am. You're not audible.
ಇಯರ್ಫೋನ್ ತೆಗೆದು ಮಾತಾಡ್ಲಿಕ್ಕೆ ಆಗುತ್ತಾ ಕೇಳಿ.
Saraswati ma'am.
Am I audible, madam?
Yes, now you're audible. Yes, fine.
Okay. Good afternoon. ಸರ್ವರಿಗೂ ನಮಸ್ಕಾರ. ಸರ್ ನಮಸ್ಕಾರ ಸರ್. ನೀವು ಯಾವ ಬ್ಯಾಚ್ ಗೊತ್ತಾಗ್ಲಿಲ್ಲ? BSc ಯಾವ ಬ್ಯಾಚ್ ಸರ್?
ನಾನು 1991.
Okay, I joined in the year 92, sir. 1992.
Okay.
Actually ನಾನು ಕೆಮಿಸ್ಟ್ರಿ, ಆರ್ಗ್ಯಾನಿಕ್ ಕೆಮಿಸ್ಟ್ರಿ lecturer ಆಗಿ ಅಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತೀನಿ ಕಾಲೇಜಲ್ಲಿ.
Right.
I'm not that good in biology because PUC second PUC ವರ್ಗು ಅಷ್ಟೇ biology ಕಲ್ತಿರೋದು.
Okay.
Okay, fine. Now we have come to the end of the webinar on the topic advantages of water treatment for hemodialysis and home dialysis by Mr. Manjunath Reddy, Senior Clinical Renal Physiologist, Auckland District Health Board, New Zealand. Mr. Manjunath has conveyed the information about the topic elaborately, which has been informative and impressive, and moreover, very relevant to the present situation. Let me brief about it As we know, kidneys are two bean-shaped organs on either side of spine. These are responsible for filtering out waste products and balancing fluids within the body. Uncontrolled blood sugar and high blood pressure, obesity, and many other factors can damage the kidneys. Then kidneys will be unable to function at their optimal level, which can cause waste buildup in the blood from the food that we consume. For those who have kidney problems, a strict diet that is restrictive in sodium, potassium, proteins, and phosphorus is a must, as damaged kidneys will have a hard time for filtering out these particular minerals out of our systems. As sir told, when kidney function drops to 15% or less than that, then we have to undergo dialysis. The resource person, Mr. Manjunath Reddy, has delivered an amazing and useful talk on the topic. Now, enough water, healthy diet, regular exercise, controlled blood sugar, controlled blood pressure, controlling weight can lead to have healthy kidneys. So, healthy kidneys like a healthy body. SJR Degree College for Women has organized multidisciplinary 5-day international faculty development program from 3rd to 7th of this month. 2 sessions went on well, and I wish all the best for the upcoming 3 sessions also. I admire Dr. Prema Siddharaju, the principal of SJR Degree College for Women, who is proactive and has been working tirelessly. Finally, I would like to thank Shri Shivprakash Sir, Honorable President of SJR Education Society, Shri N.R. Nandi Sir, Honorable Secretary of SJR Education Society, and Shri Nataraj Sir, Honorable Treasurer of SJR Education Society for their consistent support. My special thanks to Dr. Prema Siddharaju, the Principal of SJR Degree College for Women, for giving me this opportunity to preside over the session. Thank you one and all. Thank you very much.
Thank you, madam. Thank you, Principal Madam.
Thank you,
very much.
Saraswati Madam. Yeah.
Thank you.
Thank you,
Thank
Saraswati
you,
Madam.
Thank you, Saraswati Madam,
Thank you,
for your
madam.
wonderful presidential address. Now I request Megha Upadhyay, Department of Biotechnology, to propose vote of thanks. Megha, over to you. Unmute, Megha. Megha, unmute.
Good afternoon, one and all present for today's webinar. Myself, Mrs. Megha Upadhyay, Department of Biotech, SJRCW Bangalore. I would like to express my vote of thanks. First of all, I would extend my gratitude to our dynamic chief guest, Sri Manjunath Reddy sir, for enlightening us with his studies on water treatment for hemodialysis and home dialysis and its advantage. I would also like to thank our President, Sri Shivaprakash sir, our Honorable Secretary, Sri N.R. Nandish sir, and Honorable Treasurer, Sri Nataraj sir, for their valuable support and guidance. It's my pleasure to express my gratitude towards Srimati Saraswati T. Madam, Principal, SJRPU College, for her presence. Even I would like to express my gratitude towards our Principal, Dr. Prema Siddharaju Ma'am, who always directs us with upcoming facts and supports us in our endeavors. I would also like to thank our participants who cooperated and helped us to make this event a success. And last but not the least, I would also thank all the organizers, our technical team, to help bloom this event successfully. Thank you. Thanks a lot. Over to you, Jyoti ma'am.
Thank you, Megha, for your wonderful vote of thanks. With the permission of our principal, I would like to conclude. Shall we conclude, ma'am? Prema ma'am?
ಸೆಷನ್ ಮಾಡ್ಕೊಂಡ್ಬಿಡಿ, ಎಲ್ರದ್ದು ವಿಡಿಯೋ ಆನ್ ಮಾಡ್ಕೊಳ್ಳೋಕೆ ಹೇಳಿ. ಫೋಟೋ ಸೆಷನ್.
Kindly switch on the video for photo session. Anusha?
Yes, ma'am. Let them switch on. I'm just
Yeah.
saying it.
Yeah.
We request all the participants to switch on your video.
Yes, ma'am. Done.
Done. Thank you, Anusha.
ಸತ್ಯವತಿ ಮೇಡಮ್ ಇದಾರಲ್ಲ, ಕನ್ನಡ ಟೀಚರ್ ಅಲ್ವಾ?
ಸರ್, ಸತ್ಯವತಿ ಮೇಡಮ್ ಇದ್ದಾರೆ.
ನಮಸ್ತೆ ಮೇಡಮ್. ರಾತ್ರಿ ಮಾತಾಡಿದೆ ಅವ್ರ ಹತ್ರ.
ಅನ್ಮ್ಯೂಟ್. ಸತ್ಯವತಿ ಮೇಡಮ್ ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿ. ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿ ಮೇಡಮ್.
ಅವ್ರಿಗೆ ನಮ್ಮ ಕನ್ನಡ
ಸರ್ ಮಂಜುನಾಥ್ ಸರ್, ಇದು ನಮ್ದು 15ನೇ ವೆಬಿನಾರು. ಎಲ್ಲದ್ರಲ್ಲೂ ಸತ್ಯವತಿ ಮೇಡಮ್ ಪ್ರೆಸೆಂಟ್ ಇದ್ದು ನಮಗ್ ಸಪೋರ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ.
ಹೌದು, ವೆರಿ ಗುಡ್. ಶಿ ಇಸ್ ಆಲ್ವೇಸ್ ಅಡ್ಮೈರಿಂಗ್ ಪರ್ಸನ್. I always admire her, like for her efforts and everything. God bless you, madam, during this time. So you look after your health. Iga ಸ್ವಲ್ಪ careful ಆಗಿ ನೋಡ್ಕೊಳ್ಳಿ. And I always appreciate your hard work you did during my college time. And I'm very privileged, like to have.
ಸತ್ಯವತಿ ಮೇಡಮ್ ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿ ಮಾತಾಡಿ.
ಮಂಜುನಾಥ್ ಸರ್, ಇಟ್ಸ್ ಮ್ಯೂಟೆಡ್. ಮಂಜುನಾಥ್ ಸರ್ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಳ್ಳಿ.
ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಸತ್ಯವತಿ ಮೇಡಮ್ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ? ಅವರು ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿಲ್ಲ.
ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಳ್ಬೇಕು.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಸತ್ಯವತಿ ಮೇಡಮ್,
ಪ್ರೇಮಾ ಮ್ಯಾಮ್
ಮತ್ತೆ ಎಲ್ಲ ನಮ್ಮ ಲೆಕ್ಚರರ್ಸ್ಗೂ, ಸರಸ್ವತಿ ಮೇಡಮ್ ಅವ್ರಿಗೂ, ಸೊ ಆಲ್ ದಿ ಕಮಿಟಿ ಮೆಂಬರ್ಸ್, ಪ್ರೇಮಾ ಮೇಡಮ್ ಅವ್ರಿಗೂ ತುಂಬಾ ಸಂತೋಷ ಎಲ್ಲರೂ ನೋಡಿ ಡ್ಯೂರಿಂಗ್ ದಿಸ್ ಸಿಚುವೇಶನ್. So thank you for giving me opportunity to present this topic. So I'm very humbled to do for my college. SJRC has given me a lot of experience when I was a student during 1987 to 1990. Like we had all kind of good experience there. Like thank you all the principal sir ಮತ್ತೆ ಎಲ್ಲ ಲೆಕ್ಚರರ್ಸ್ಗೂ ನನ್ನ ಧನ್ಯವಾದಗಳನ್ನು ತಿಳಿಸ್ತಾ ಇದ್ದೇನೆ. ತುಂಬಾ ಸಂತೋಷ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
ಸರ್, ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ನಿಮ್ ಬಿಸಿ ಶೆಡ್ಯೂಲ್ ಮಧ್ಯೆ ನಮ್ಗೆ ಒಪ್ಕೊಂಡು ಬಂದು ತುಂಬಾ ಒಳ್ಳೆ ಒಂದು ಪ್ರೋಗ್ರಾಮ್ ಕೊಟ್ಟಿದ್ದೀರಿ. ಇದರಿಂದ ತುಂಬಾ ಜನಕ್ಕೆ ಹೆಲ್ಪ್ ಆಯ್ತು. ಈ ಒಂದು ಏನು ನೀವು ಹೇಳಿದ್ದು ಒಂದು ವಿಚಾರ ಸಾಕಷ್ಟು ಜನಕ್ಕೆ ತುಂಬಾ ಹೆಲ್ಪ್ ಆಯ್ತು. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ಮೇಡಮ್ ಈಗ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. ಸತ್ಯವತಿ ಮೇಡಮ್ ಮಾತಾಡ್ತಾರೆ ನೋಡಿ.
ನಮಸ್ತೆ ಮೇಡಮ್, ಕೇಳಿಸ್ತಾ ನಾನು ಹೇಳಿದ್ದು?
ನಮಸ್ಕಾರ ಮಂಜುನಾಥ್ ಅವರೇ, ತುಂಬಾ ಚೆನ್ನಾಗಿ ತುಂಬಾ ಉಪಯೋಗಕರವಾಗಿತ್ತು.
ಇವತ್ತು ಸರಿಯಾಗಿ ಮಾತಾಡಿದ್ನಾ?
ತುಂಬಾ ಚೆನ್ನಾಗ್ ಬಂತು.
ನಾನು ಹೇಳಿದ್ರಲ್ಲ ತಲೆ ಎತ್ಕೊಂಡು ಮಾತಾಡಿ ಅಂತ.
ಹೌದು, ಇವಾಗ ಕರೆಕ್ಟ್ ಆಗಿ ಬಂತು. ಚೆನ್ನಾಗಿ ಕಾಣಿಸ್ತಿದ್ದೀರಾ.
ಸರಿ. ಥ್ಯಾಂಕ್ ಯು. ಎಲ್ಲ ನಿಮ್ಮ ಆಶೀರ್ವಾದ.
ಏನು ಅಲ್ಲ, ನಿಮ್ಮ ಪರಿಶ್ರಮ ಮತ್ತೆ ದೇವರ ಆಶೀರ್ವಾದ ಎಲ್ಲ ಸೇರ್ಕೊಂಡಿದೆ.
ಅಲ್ಲ, ನಿಮ್ಮಂತವ್ರ ಆಶೀರ್ವಾದ ಇರ್ಬೇಕಲ್ಲ. ನೀವು ಹೇಳ್ಕೊಟ್ಟಿದ್ ಪಾಠ
ಖಂಡಿತ ಇರತ್ತೆ. ತುಂಬಾ ಸಂತೋಷ ಆಯ್ತು. 2 ಸಲ ನಮ್ ಕಾಲೇಜಲ್ಲೂ ನೋಡ್ದೆ ಅಲ್ಲ, ಅದು ಜೊತೆಗೆ 2.
This is the international webinar first time ನಾನು ಕೊಡ್ತಾ ಇರೋದು. So hope it will be continuing. So ಮುಂದೇನು ಬೇಕಾದ್ರೆ ನಾನು ಅದೇ ಇನ್ನೂ ಸ್ವಲ್ಪ ಇದು ಪೀಡಿಯಾಟ್ರಿಕ್ ಬಗ್ಗೆ ಮತ್ತೆ ಇದು ಬೇರೆ ಟಾಪಿಕ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತೀನಿ. ಮತ್ತೆ ಯಾವತ್ತಾದ್ರೂ ಫ್ರೀ ಇದ್ದಾಗ ನೆಕ್ಸ್ಟ್ ಪ್ರಾಬ್ಲಿ ಅನದರ್ ಫ್ಯೂ ವೀಕ್ಸ್ ಟೈಮ್.
ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಮೇಡಮ್ ಸತ್ಯವತಿ ಮೇಡಮ್ ಅಲ್ಲಿ ಕನ್ನಡ ಸಂಘಟನೆ ಮಾಡ್ಕೊಂಡು ಕನ್ನಡ ಅಸೋಸಿಯೇಷನ್ ಅಲ್ಲಿ ಫುಲ್ ಇನ್ವಾಲ್ವ್ ಆಗಿದ್ದಾರೆ. ತುಂಬಾ ಒಳ್ಳೊಳ್ಳೆ ಪ್ರೋಗ್ರಾಮ್ಸ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ನಿಮ್ ಶಿಷ್ಯ
ಮೊದ್ಲಿಂದ ಇನ್ನೂ ಪ್ರಾರಂಭ ಆಗಕ್ ಮೊದ್ಲೇ ಎಂಟರ್ ಆಗಿದ್ದೀನಿ. ಬಟ್ 2 ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಂಡಿದ್ದೆ. ನಿಮ್ ಭಾಷಣ ಎಲ್ಲ ಕೇಳ್ದೆ, ತುಂಬಾ ಸಂತೋಷ ಆಯ್ತು. ಅವ್ರ ಕಾರ್ಯಕ್ರಮಗಳು ನ್ಯೂಜಿಲೆಂಡ್ ಅಲ್ಲಿ ಅವ್ರ ಮಕ್ಕಳಿಗೆ ಮಾತ್ರ ನೋಡಿದ್ದೆ ಫೋಟೋಸ್. ಬಟ್ ಇನ್ನು ಕನ್ನಡದ ಬಗ್ಗೆ ಅಷ್ಟೊಂದು 35 ಜನ ವಿದ್ಯಾರ್ಥಿಗಳಿದ್ದಾರೆ, ಅದೆಲ್ಲ ತಿಳ್ಕೊಂಡು ತುಂಬಾ ಸಂತೋಷ ಆಯ್ತು.
ಇನ್ನು ಎಲ್ಲ ಇದೆ ಆನ್ಲೈನ್. ನೀವು ಕನ್ನಡ ಕೂಟ ನ್ಯೂಜಿಲೆಂಡ್ ಕನ್ನಡ ಕೂಟ ವೆಬ್ಸೈಟ್ ಹೋದ್ರೆ ಎಲ್ಲ ಇದೆ, ನಮ್ಮ ಪ್ರೋಗ್ರಾಮ್ಸ್ ಎಲ್ಲ ಇರುತ್ತೆ ಅದರಲ್ಲಿ. ಪ್ರತಿಯೊಂದು